Maud is going to mute everyone and welcome everyone to this update. You know, it's been a real roller coaster ride with the reopenings and the different phases that counties and businesses are encountering as we try to work back or forward into some kind of new normal. So this week we're going to be talking about Oregon's yellow light unopening, and we're also going to talk about some return to work challenges that employers are facing. Then we're going to go to some questions that were asked last week and provide some links and resources. But first, on the next slide, we are the Caputo Group. We take on HR compliance, payroll, benefits, and liability in order for your business to be able to focus on what it's good at, your craft, and we give your small business, big business expertise. We also conduct activities like this to help keep all of our clients and industries that we support in touch with the latest developments that affect their business and the economy. So moving on to the next slide. Recently, in a June 12th press briefing, Governor Kate Brown of Oregon announced that she was going to be hitting pause, a yellow light, on the state's reopening, further reopening, because as of June 16th, 278 new cases have been identified in the state of Oregon. And those upticks had started right around the beginning of June. And quite simply, the yellow light happened because public health officials really needed the time to research and assess the factors that were driving the resurgence, to make sure and test out the capacity of the health system to handle the resurgence, and then also to assign and reapportion contact tracers and the teams that conduct that type of work to the areas where they were needed. So during this pause, all counties stayed in the stage that they were in, while the Oregon Health Authority continued to analyze the incoming data. So they analyzed number of cases, they analyzed hospitalizations, and then when the data started to come in, they started to get the results of the contact tracing. Okay, so on the next slide. Oh, okay. So the latest from Governor Brown came in a press release from yesterday, and then today there was a press briefing. Okay, so what's going to happen is that the reopening will continue under the following conditions. So indoor face covering requirements are in place for Multnomah, Washington, Clackamas, Hood River, Marion, Polk, and Lincoln counties, and that's effective as of 6/24. Marion, Polk, and Hood River counties have been given clearance to move on to phase 2, and that will be on the 19th of June. And Multnomah County finally gets to go from the baseline to phase 1. So cautiously moving forward. She is also grouping counties into regional groupings. So Multnomah, Washington, and Clackamas County are all going to be one region now, and they are either going to move forward, backward, or stay in place together. And then another regional grouping is Marion and Polk counties. Okay, so on the next slide. So let's have a look at some of the context of the uptick. Okay, so clearly there was an increase in testing, which led to an increase in discoverable cases. So clearly the numbers are going to go up as the testing that, you know, we were hoping to put in place starts functioning. It's part of the whole arc of the pandemic and our response to it. So that's partially responsible for the numbers that you see. However, there were these localized outbreaks. And so let's have a look at just some of the outbreaks. There was a Pacific seafood outbreak, which many of you may have already heard about. That was in, it was the seafood plants that are in Newport. And as of now, Pacific Seafood has temporarily closed all of its facilities that are in that area. As of the last counting, there were 53 employees and 71 contractors associated with Pacific Seafood that came down with the coronavirus. Now, it's interesting because 95% of these positive cases are reportedly asymptomatic. However, the contact tracing has been activated and the people have been quarantined and they are following the procedure that was put into place. We had another outbreak at a prolonged care facility. That's Marquis Hope Village in Canby. So this is a retirement home, and they seem to also have that under control. There has been no spread to the adjacent facility, and all employees and residents are regularly tested. And the Oregon Department of Human Services is checking in on them regularly. There have been 3 deaths at that facility, which is unfortunate, but that is a high risk demographic, as we all know. So the biggest outbreak so far has been linked to churches. And Lighthouse Pentecostal Church in Union County, well, basically what they did was they reopened their church services actually before the clearance. And at the end of May, they had a big worship ceremony at church with a lot of singing and dancing and shouting. They even posted a video of that on YouTube, which was quickly taken down after the news of the outbreak reached the media and started to become a bit of a meme. Because of that outbreak, Union County has voluntarily decided to move back to phase 1 in order to get a better handle on things. The authorities, however, the public health authorities, are definitely confident that they can do the test, trace, and treat protocol with Union County. And apparently there's enough personnel, there's enough PPE, there's enough room in the hospitals for now. So early indicators are that that's also being handled. So, and it's interesting, a lot of people were wondering in these past weeks about the relationship of the protests to coronavirus cases. And up until this week, I think the last time I checked on this particular factor was Tuesday, only 5 cases had been traced back to protests. And it's interesting because the protests are outside, and if you look at a lot of the footage of the protests, people are wearing masks. So it's interesting to note how these things are moving forward. All right, on to the next slide there. This is a very, very fascinating article. If you would like to know more about the mechanics of how this disease is spread, it's a great article, and I wanted to just include this in here for you because as we move into phase 2 and as we move into calling our employees back in, These are some of the common sense points that are good to observe. So Dr. Erin Bromage, who has a PhD in biology from and teaches at UMass Dartmouth, in this article talks about how outbreak clusters usually tend to be environments that are enclosed with poor air circulation and a high density of people. So here are some of the examples of that. We've got prisons, religious ceremonies, public transit, and workplaces like meat packing facilities and call centers where there is a lot of talking going on. And like meat packing or the seafood plants, for example, you've got a lot of line workers that are working in an environment where there's a lot of machinery making noise, so they have to communicate by shouting to each other, and it tends to be colder, and that favors this virus as well. Call centers, it makes sense that people are in closed quarters and they are talking, and when we talk or we sing or we yell, essentially what we're doing is we're aerosolizing the virus and we're getting those droplets out of there. And the way that you catch this disease is through droplets, and the article talks about that the formula for actually contracting the virus is your exposure times the time that you are in the space with the infected person. So you're rarely going to get it just from a passerby. You're going to get it through talking with people or being in an environment where people are talking a lot. So restaurants are also, unfortunately, vectors for this as well, which is why the social distancing is so vital for preventing restaurants from being vectors. But you will see in that article, if you are interested, it's a very, very fascinating article, very informative about how this virus spreads. Because certainly, even with the health system still learning about it, there is a lot of doubt. There's a lot of fear out there right now. People are mixed on where they fall with the shall we open or not open yet spectrum. So what this has resulted in, especially as we move into phase 2, is employee reluctance to return. So on the next slide, this week I spent a lot of time on the human resource websites and researching employee attitudes about coming back. So there is this wave of employee reluctance to return. Some of that is owing to a fear of contracting the virus at the workplace. Some of that is also owing to the economic disincentive in terms of the enhanced unemployment insurance benefits that people are getting. So where does that leave HR? So since no two employees are alike, especially now in this transitory phase, it's important to listen actively to employees' concerns. It's going to be important for employers to be as flexible as possible in the options that they offer their employees. It's going to be super important to communicate company policies very, very clearly to all employees. And then lastly, to document all of these steps that have been taken very, very carefully, because it's going to be a tricky time coming up ahead with the possibility for workplace litigation to take place. So employers do have to be very careful about how they proceed right now. So on the next screen here, we've got some updated safe workplace guidance that has come in from the CDC. Clearly the hygiene, the distancing, and the personal protective equipment is still in place. Screening is going to be another issue now. So the updated guidelines include for phase 2, moving forward, daily health checks. It's being recommended that each business do a workplace hazard assessment so that you can figure out where your business falls on that spectrum and what types of measures you need to be taking in your business. One big consideration for employers, especially, you know, where you have a lot of employees working indoors, is improved ventilation. And then also creating and communicating and implementing a COVID-19 response plan. So to help you out with that process, down there at the bottom is a CDC reopening decision-making tool. So it's kind of like a flow chart, if this, then that, as you start to navigate what's coming up. Because as we can see on the next slide here, not all businesses or workplaces are going to have the same level of risk. Some are in a very high risk level. Those are your healthcare workers, your lab personnel that are working with specimens, morgue workers. So people with a very high risk of exposure to those that are known or suspected of having COVID-19. In the high risk category are your healthcare delivery personnel and your support staff who have to come into and out of patients' rooms. So they might not be in direct contact with the patient, but they still work at the healthcare facility. Medium risks are places like schools or salons, some retail is considered in the medium risk category. And then your lowest risk are your office workers, unless of course you're a call center where you have all of this talking going on. So there are different ways to respond to the level of risk based on what it is you do. You know, how many front-facing personnel do you have? What is the volume of foot traffic that would come into and out of your business? What do your employees need to touch that your customers or your clients are going to be touching? How can you reduce the touch? How can you increase the distance? So here again, we've been going over these same themes now since the reopening started. But now, as we're moving into phase 2, and as more groups of employees are starting to be called back, there are more considerations that need to be dealt with in order to be able to move forward productively. So let's have a look now at some best practice. There we go. So, excuse me. Oh my gosh. So, it's been recommended that the employer very, very clearly communicate to everyone that's being called back why the company's work is permitted to resume, how that fits in with executive orders, how that fits in with the phase 2 protocols, whether it's in the state of Oregon or in another state. It's recommended that employers write a very thorough and detailed recall letter that employees will then sign off on. It's important to have empathy and to know that people are going to be having concerns. So it's going to be really important for employers to reassure their employees on issues of safety and hygiene, to let people know that there are going to be regularly scheduled health screenings and that the mitigation protocols in place are clear and understandable to everyone, not only to the employees, but to the public that would be patronizing the business. So one of the considerations is to, prior to the phase 2 callback, have a company-wide Zoom to go over the entire reopening process, have people ask their questions, raise their concerns, be able to talk them through the whole process over Zoom first. And then lastly, carefully document all these steps that you are taking as an employer so that you have legal proof that you did everything within your power to offer safe and employment, and that you can also use this documentation in your calculations for PPP loan forgiveness. So it's going to be very, very important, no matter what the business is, to document their process throughout this very, very uncertain time. And I know that, in my research on this topic, there are a lot of ambiguities about it. There's a lot of language like in reasonable and good faith efforts and that sort of thing. It's clear that we don't have a playbook for this. I've said this many times during these webinars. It's clear that there are a lot of real-time adjustments that are happening on a day-to-day basis, but if somebody in the company gets in the habit or it's assigned to that person, you must document everything that we do while going through these reopenings. It's going to be first of all necessary for your PPP forgiveness, but second of all, if any kind of litigation should take place, you're covered. The employer is covered. So let's move on to the next slide. Say you have an employee that's very, very reluctant to return, okay? Here again, all of the great sources that I'll share with you this week, they really, really stress good communication, empathy, talk to your employees, determine what is really behind their fear of coming back. And then as an employer, you should make sure that you know if it is a legally protected reason that the employee is refusing to return. So here are some of the legal reasons, okay? Obviously, if they're high risk or they're sick or they've been exposed, that is a legal reason to not return to work. And then of course they need to have medical documentation of the steps that they're taking to deal with that. Another one, and this goes back to FFCRA, the Families First Coronavirus Response Act, which provides the emergency family leave provision for employees, and that includes unavailable childcare. So if your employee is not able to come back because they don't have childcare due to the COVID-19 pandemic, that is a legitimate reason for them to not come back. And that rule has now been expanded to include summer camp. So if somebody was counting on being able to send their kids off to summer camp and it closes down and then they can't go to work, guess what? It's a legitimate reason. With OSHA and safety concerns, employees, if they're reluctant to come in because of safety, and then they report that to OSHA as well. There's been a lot of language in the recent OSHA guidance about reporting that it needs to be a reasonable and good faith effort to expose a safety concern in the company that is based on fact. So I have a feeling that, a lot of this is, it's not carved in stone yet. So there's going to be a lot of gray areas, and I put this little statistic down there at the bottom. 70% of in-house legal counsel worries about potential lawsuits stemming from COVID-related employee issues, and that's from HR Executive. It's an HR sort of resource bank website. It's got a lot of good guidance for HR managers throughout COVID. You know, and then you've got concerns like the Americans with Disabilities Act. You've got to make sure that you're not discriminating against an employee due to their age or any other issues that they might have. We talked about family medical leave. We talked about FFCRA. There's also the WARN Act, which is it goes down to wrongful firings and the way that employers let people know about layoffs. And so it's going to be an interesting time for companies legally these days as they move forward through the reopening. So on this next slide here, one thing that most of these sources agree on is that the general fear of COVID is not a valid reason to refuse unemployment. So if they haven't met any of the medical criteria, they're not sick, they haven't been exposed, they don't have a child that needs to be cared for, they're just afraid, it is not a legitimate reason to refuse employment. Okay, so however, according to OSHA, like I said earlier, employees can refuse to return if they have a, quote, reasonable, specific fear of infection based on fact and not just a generalized fear of COVID. So if they see something going on in the workplace, like people clumping together in closed areas or, you know, sharing equipment, you're not supposed to share any equipment right now. You're not supposed to share any laptops or tools, you know, none of that. So if they see stuff like that going on and they are afraid of coming back to work because of that, that is a reasonable, specific fear of infection that they can document, right? But if it's just, oh, I don't know, it's phase 2, I don't know, unfortunately, that is not a legitimate reason, because the employer has to document that they offered the employee employment. And then if the employee refuses, the employer has to document that refusal, which then also has to be reported to unemployment because they were offered a job. So it's an interesting configuration. So, okay, they can also refuse to work if, refuse to return to work if the employer cannot address their specific fear in a way that ensures a safe working environment. So, you know, the human race is so ingenious. Somebody will always find something to be worried about, or what about this, or what about that? But it's important for employers, like I said, to listen and to try to mitigate their employees' fears as best as possible. And if the employer cannot address a specific, reasonable, well-founded fear in a way that ensures that they will make that situation safe, then the employee can refuse to return. I imagine that something like that's probably going to end up in a court where, you know, they're going through how well people documented things. So there we have it. So let's see on our next slide here. Okay. So you have a persistent resistor. You know, I keep getting this message, tread lightly with employees, because they have many, many legal protections, especially in this COVID era. right now. See if there are some flexible ways that that employees' continued leave of absence can happen, such as offering them the paid time off or maybe an unpaid leave of absence. If the employee's refusal to return is based on them making more money on enhanced unemployment, that's not going to last very long either, because legally they have to report, they have to acknowledge and report that they were offered work. So at one point or another, that is no longer valid. Okay, like I said earlier, the employer must also report and document offers of work as well as employee refusal if none of the valid reasons apply. And yes, employers can compel and require the use of PPE. So, you know, in a lot of my research that I did this week, we see that there are employees that are very resistant to wearing masks at work. So that's going to be another delicate balancing act for employers. You know, because you could rub up against legislation, for example, from the Americans with Disabilities Act. I mean, what if you have somebody that's older and, you know, they can't breathe very well, and are you going to compel them to use personal protective equipment? Or how are you going to pivot? How are you going to make reasonable accommodation for those employees? And so really what it seems like is that employers are just going to have to be taking cases like this on a case-by-case basis. There is no rubric, there is no pattern or foolproof pattern for anyone to follow. But I think if we let empathy and flexibility lead the way, that employers will be in a good spot. So let's have a quick look here. We've got some updates here on the Paycheck Protection Program loans and the economic injury disaster loans. We've got some updates. So now the PPPL has an easy forgiveness, which is a streamlined application, a much easier application with less documentation and less paperwork. And it's particularly targeted to those who are self-employed or have no employees. Also to those who did not reduce the salaries or wages of employees by more than 25% and didn't reduce the number of hours. And then lastly, for businesses who experienced reductions in business activity as a result of the health directives related to COVID-19 and did not reduce salaries or wages by more than 25%. So if your business fits into any one of those categories there is an application for this streamlined, easy forgiveness for your PPPL. And then on the next slide, the EIDLs are back. The economic injury disaster loans are back. This is targeted towards these categories here. So there's independent contractors, and there is expanded eligibility criteria for that, which you can learn more about at the link down there below. For freelancers, sole proprietors with or without employees, gig workers, small businesses with less than 500 employees, and agricultural businesses. So there's still a little bit of ambiguity about how much those loans can be. I've read anywhere from 150 to 2 million again, and they do have that grant that's attached, but it is no longer a clean $10,000 grant. It's $1,000 per person up to $10,000, and you don't have to pay that back. So there's the application form for the EIDLs. Okay, and then on our next slide here. So last week we had a lady ask a question about Can businesses who have Paycheck Protection Program loans defer the payroll tax? So to me, it sounded like the double dipping law that we talked about, oh, I think maybe 6 weeks ago. And so I reached out to Tyler Hokama of the SBA and the Small Business Development Center. And he confirmed that it is double dipping. And he said, well, you know, the government has already given you the money, so why can't you pay the tax? And so the answer to that question then, it's no. And he recommends that businesses contact their local SBDC, which is Small Business Development Center chapter, for personalized help and advice with the PPPLs and all the forgiveness issues. And to be truthful, I've heard a lot of good things about SBDC. It seems like it all depends on which one you get into contact with, but they've really been helping businesses make heads or tails out of the whole forgiveness question and helping them navigate this process. So here are some resources and links that I think that you'll really get a lot out of. This is the Fisher Phillips Law Firm that has an updated employer FAQ on phase 2 return to work issues. So they are labor lawyers, and they're a really, really good source for wrapping your head around the legal issues that are associated with returning to business. Here is the next one is SHRM, the Society for Human Resource Management, which is just a fantastic resource. It's for human resource managers, and they've really got their finger on the global pulse of the workplace right now. They've got members from all over the world, and they also have fascinating webinars. If you're interested in watching their webinars, they get HR experts from all over the world to come and talk about, well, here's what we're facing in my country, here's what we're facing in this region or that economy. So it's fascinating to see some of these longer term impacts on the world of work that COVID has been having, and some of the ways in which work is probably permanently going to change going forward. Human Resources Executive is another really, really great resource for HR. And then, of course, the SBDC, the Small Business Development Center. So, as always, for a free consultation on how your business can navigate COVID-19 paid sick leave and other issues, please visit www.caputo-group.com. And then Maud is going to give you the link that you can use to access the slide deck and to rewatch this video. And so that's it from me for this week. I'd like to thank you all for coming out again, and I'll hand it back to Maud.
Sophia, thank you so very much for all of this great information. Again, every week, just the amount of digging that I know you do to make sure that we get really great up-to-date information is fantastic. So thank you again so much. Thank you, everyone. Thank you, everyone, for joining us today. And we look forward to seeing you again on our next installment.